Okay, good afternoon, everyone. Welcome to our COVID-19 update for January 18th. See, we're joined by Karen Gambino from Deaf Access Services, who will be providing the American Sign Language. It's just me today. Dr. Burstein is currently on a conference call with New York State about new test-to-stay guidance. She's on with other health directors. So just me today, as we'll give the latest numbers on COVID and talk about a couple other things. And we do have some good numbers to announce. It's been like this for almost a week and a half now. So let's get right to it. The COVID-19 case data summary for January 17th showed that there were 1,253 new cases. This does not include the at-home test information that we may receive or was done elsewhere. Positivity was 20.4%. That's higher, but it's actually better than the week before. I'm going to go into that in a great deal. What we've been able to determine is that 5.6% of Erie County residents had a lab-confirmed COVID-19 positive case during the past 4 weeks. We certainly have seen a lot of COVID in Erie County, just like the whole country has during the past month. Though based on the data we do believe we have peaked and we are going down. And to give you an example of it, this data for the 17th had 1,253 new cases, with 1,436 being the 100,000 residents per past 7 days. The positivity rate, 20.4%. That is all lower than the previous week in comparable numbers. So that's a good thing. Just to give you an example alone, on Monday of January 10th, there were 2,534 new cases, and the positivity rate was 27.2%. So both of those have dropped, and this is continuing a trend. The weekly COVID-19 cases for the week that ended on January 15th had declined by 16% from the week that had ended January 8th. It was the first decline from the previous week since the week that ended December 18th. The case rates have dropped per 100,000. The positivity rates have dropped. For example, for the week that ended January 8th, there were 2,024 new cases per 100,000 residents over a 7-day period. That had dropped to 1,688 by the week that ended the 15th. And if you look at the last 7 days of data, that had actually dropped to 1,436, as we just noted, so it continues to drop. The weekly positivity rate for the week that ended January 8th was 24.8%. It was 23.5% for the week that ended January 15th, but I took a look at the last 7 days from Monday through previous Tuesday, and that has gone down to 21%, so it continues to drop. That's a good sign, seeing the positivity rate drop, overall cases drop, the case rate per 100,000 residents drop. We believe we've peaked with regards to the Omicron variant increase, which was huge. 20 to 39-year-olds continue to be the age group with the highest case rates. That's been pretty standard for basically 6 weeks or more now. So it is generally those in the 20 to 39-year-old age category that are testing with the highest case rates on a weekly basis. Hospitalization. You see a new chart here. We're changing the design of the hospitalization chart to better reflect what is actually going on in the hospitals. So the new chart will show all COVID positive patients. That's the red line. Those are every single person who is COVID positive. But we also will include two different bars, which are in the same stacked number, so you can see what percentage they make up. The light blue bar are those that are admitted for COVID, and the dark blue, nearing purple, are those that were admitted to the hospital for something else other than COVID, but they found out they were COVID positive when they were in the hospital. So for the most recent day of data, which is January 16th, you see a big total. 567 people were admitted to Erie County hospitals that were COVID-19 positive. But of that number, 338 patients were admitted for COVID, with COVID, and 229 were admitted for something else. So what we're seeing is that number of people who are admitted for something else is growing. You can see in this chart, the baby blue, the light blue, is not growing, and it's actually lower than the highest number we had data for, which was 341 about a week ago. So it's kind of bouncing a little bit, but it's staying in that same area. What's growing are the number of people who are in hospital with COVID-19, but not there for a COVID illness. They may be there for a surgery. They may have a broken leg. They may be there for something completely different than COVID-19, but they find out they're COVID-19 positive. That number is growing. It is still a burden on the hospitals when they identify that someone is COVID-19 positive, because they have to put them in a different ward. You can't have a COVID-19 positive patient in with a non-COVID-19 patient. You wouldn't want somebody who's in for cancer treatment that has a weakened immune system in the same room as someone who may be there for a broken leg but happened to test positive for COVID. So it is still stressful to the hospitals, but we're glad to see that number of individuals who are being admitted for COVID seems to have stabilized. Erie County's hospital capacity has also seemed to stabilize. We've been hanging around this number lately. 85% of all hospital beds are being occupied. That's 80.5% of ICU beds. I took a tour last week of ECMC's emergency department. They had some rooms available, not a lot. Still a lot of people going to the hospital for all kinds of illnesses. But while it's tight, they do at least have some capacity. This varies by hospital. Some hospitals have no acute care beds available, but they might have an ICU bed. Some have quite a number of acute care beds available, but less ICU. So it varies by hospital, but as a region, we do seem to have peaked as well with regards to the number of patients who are being admitted for COVID-19 as compared to just overall the positive patients that have COVID-19. And here's the chart with regards to hospitalization data. From the beginning, if you look at this chart now, it seems it's the worst. It is not good. But if you look at it from where it was in November, when almost all of these people were admitted for COVID-19, in November of 2020, I should say, not 21, but November of 2020, there was over 450 cases on some days. And we now know we're down to 338 that are in hospital for COVID-19. The hospitalization data for Western New York, once ago, shows this big peak. I don't know what the percentages are in the other counties. You'd have to check with the other counties to find out what the percentages are of individuals that are COVID-19 positive in their hospital that are actually admitted for COVID-19. Vaccination update through January 17th. We still have some very high numbers with regards to one dose. Booster doses in all of Western New York, 453,008 people have gotten a booster dose through the 17th. There were 24,326 people who got a booster dose in the past week, but we need many more people to get a booster dose. We have a lot of people who had a first dose, pretty much comparable numbers with regards to second dose, but we have dropped a lot with regards to booster dose, and we know the booster dose protects you, especially from the Omicron variant, if it has been more than 6 months since you had your original completion of your Pfizer or Moderna regimen, or 2 months for the Johnson & Johnson. If it's been longer than that for you, go get boosted. They're available everywhere and they're free. Erie County responds. Vaccine sites, we got lots of vaccine sites. There are vaccine sites everywhere. This is where you can get a booster dose. You can call our phone number, 716-858-2929, to schedule an appointment somewhere else, or a Vax visit, in which we'll come right to your house and give you the vaccine at your home. If you don't want to be seen getting vaccine, if you were a little vaccine hesitant and you want people to see you getting the vaccine, we'll come right to your house. We don't care. Pediatricians, physicians' offices will do it. They're doing it in schools. We've been working with schools to continue to have vaccine availability for students. We must get the parents' permission, of course, but many more parents have been taking advantage of that, and we're very grateful for everybody who did. Testing. This is very interesting because we have a lot of people who are saying they can't get tested. We have open slots every day at our testing locations across Erie County that the Erie County Department of Health has. You can call us, 716-858-2929. You need to schedule an appointment. However, same-day appointments are generally available, so if you called me, not me, if you called the county, I should say, the 858-2929 number, this morning, you would have gotten an appointment this afternoon. If you are symptomatic, we'll get you on the rapid at home, not at home. We'll get you the rapid test. That's the Abbott ID Now test. We'll get your results in 15 minutes. If you don't have symptoms, we'll test you. We'll probably get your results back in a day. Generally, it's a one-day turnaround. We say 1 to 3 business days because if we test you on a Friday, you might not get your results until Monday. But in general, you get your results in one day. And we want people to understand there is plenty of testing capability in our community. New York State has expanded its locations, and I know not every slot is filled. And Erie County has expanded its locations, and not every slot is filled. Tomorrow, we have a testing clinic at Elam Christian Fellowship Church on the east side of Buffalo. I believe that's Chandler Street off East Amherst. Testing site from 10 a.m. to 8 p.m. I want to thank everybody associated with Elam, including Bishop T. Anthony Bronner, for allowing us to come back there. This is not the first time we've been at Elam. We were there for a vaccine clinic before, and we're glad to come back and use their facility as a testing site. If you live in the east side of Buffalo, you can call 716-858-2929. Get a test tomorrow at Elam. The rapid test for those that are symptomatic will get your results. If you're not symptomatic, you'll probably get your results on Thursday, because today, of course, is Tuesday. The clinic will be held on Wednesday. And if you do schedule an appointment and you can't make it, please call us. Please cancel it. We don't want people wondering whether someone's showing up or not. We'd appreciate if you call us if you have to cancel your appointment. Big announcement today that came out about an hour and a half ago. The federal government, as we heard, was going to offer free COVID at home tests through the mail. And now that site is live at https://www.covidtests.gov. So if you type in www.covidtests.gov, you can order up to 4 free at-home tests that will be sent to you, no charge from the federal government. The site is live. I actually ordered mine about 15 minutes ago, and the initial deliveries are expected to come in late January. So if you're looking for an at-home test, you haven't been able to get them, the federal government is now offering them. It will take a little bit of time, a couple more weeks before they actually arrive. They're expecting 7 to 10 days is what they're saying, 7 to 12 days on the screen. But you should, if you order today, you should get your 4 free tests per household by the end of January. So take advantage of that. As I said, if you need a test right away, we have plenty of testing capability. Call us, 716-858-2929. Don't run around thinking you can't get tested, because there is plenty of testing capability. But if you want a rapid at-home test, you can order one right now through the federal government. Big thank you all the Public Works and Emergency Service employees, like our friends at the 911 call center. We got 20 inches plus of snow across all of Erie County, or most of Erie County. Some only got 12 to 15, but it's rare when we have a snow like this that hits all of Erie County. This would shut down pretty much any other metro region, especially south of us. It doesn't shut us down. I want to thank all the municipal, the city, town, village, of course, our county and state workers who helped during the storm. Our Department of Public Works was out early, pre-treating the roads on Sunday. Sunday was a gorgeous day, beautiful day. I was out skating at Como Park, gorgeous, absolutely perfect day, but we knew the storm was coming. We were pre-treating roads starting around 6, 7 o'clock. Snow started around 8. We were out there throughout the whole duration. We also had equipment in the city of Buffalo from the start. We were doing parts in downtown of Delaware, Elmwood, Pearl Street, the areas around the Rath Building. We normally don't do that, but we knew the city might need a little help, so we had people out there and our crews out there, and we still actually have a few crews helping out in the city. I want to thank all of the Public Works, emergency services, first responders, and the like. It was a big storm. It wasn't a terrible storm. We're back. We're back in business as usual. Nothing shut down from the county. We know the city of Buffalo schools were closed today. As someone who lives in the city, it was a good decision. I know they originally said they were going to actually have school today. They changed their mind. That was a good decision, because there is still a lot of parts of the city of Buffalo that need to plowed, and I have talked to the mayor. I know they're working on that. But the county is assisting. New York State is assisting. They've been helping out as well. I know New York State DOT plows were out on the road during the height of the storm as well. So thank you to everybody for all your hard work. I'm a little sore today because I did a bunch of shoveling myself, so I probably should have taken some sort of leave or a different type of pain reliever. But those are the pains you deal with when you live in this region when it comes to shoveling heavy snow. And thank you to all who did a good work to get us through this without any real issues. And then finally, I was at the football game. We beat the Patriots. That was a beautiful thing. It reminded me of what it was like during the Super Bowl years. People were so excited. It was a great game. Former Bills quarterback Ryan Fitzpatrick was out there cheering without his shirt off. It was a wonderful occasion. So I just want to say, go Bills, beat the Chiefs, and redemption will be sweet after what happened last year. So go Bills. Looking forward to the game on Sunday. It's going to be awesome. So to the team, Josh Allen and everyone else, great job destroying the Patriots. Very happy to say that. And now it's on to the next round where I know they're going to take down the Chiefs. With that, we'll open it up to questions to the public, or I should say the public, from our friends in the media. Oh, one final thing. These things aren't necessarily nice, but they happen. There was a rumor last week that I had COVID, and that's why there was no press conference, and that is completely false. To my knowledge, I've never had COVID, and I've been tested a lot since the beginning of the pandemic. We just couldn't do the press media event last week because we were busy. There was a lot going on. Our schedules between myself and Dr. Burstein didn't match, just like they didn't necessarily match today. But we didn't do the press briefing last week. I'm doing the press briefing now, but I want it to be known because there were some rumors that were being spread that I was seen at the football game and other places and I was COVID, and the answer is no. I am not COVID. I have never had COVID to my knowledge. If I have COVID, I'll let the public know about it. I mean, it's nothing to be ashamed of, but if I did catch COVID, I'd let the public know. But to my knowledge, and I've done a lot of testing, I've never had COVID, and I certainly haven't had it in the past week. So with that, we'll open it up to the media, and we'll start with the Buffalo News, Sandy Tan.
Hi, thank you. I wanted to know if you had any reaction to the governor's announcement of her budget priorities and what she obviously has announced more spending for capital projects for the pandemic. You noted potholes. I didn't know if that had any impact on the county's budget or projections.
Well, we certainly don't include in our budget anything that we think the state might do. We don't have that knowledge. So the governor announced a lot of big initiatives. Tomorrow, Deputy County Executive Maria White is joining others to announce the results of a really in-depth review that Cornell University did of Erie County's child care. And we know we are woefully underfunded on child care, and I saw the governor announce today $1.4 billion in total for child care. That's something that we've been talking about with the state, as have other counties. Talked about the $1 billion for potholes. There's also some really important things that were announced with regards to Medicaid, as well as local assistance for municipalities. Governor Cuomo basically eliminated the AIM funding that's paid for by the state and made the localities pay for it out of sales tax. And that was really unfair for the localities and the counties to have to pay for it out of sales tax when it had always been state. And I saw the governor announce today that they were going back to the traditional formula in which the state will pay the local municipal assistance. Actually, one of the reasons we couldn't do this tomorrow is because in the afternoon I'll be heading out to go to Albany. I will be meeting with the governor in the evening tomorrow, talking budgetary issues as well as with a few other county executives. So I'm looking forward to that. And we'll certainly talk a lot more about the budget as well as some of the other things that we have in county government, though I know, as I kept it on the screen, and I'll keep it on the screen, we don't need to have anything else for now, but we'll also be talking about the Bills game. And of course, the governor and I talk a lot about the Bills negotiations. And before anybody asks that question, we're still negotiating. I don't really have a whole lot to add other than we keep on negotiating and progress is being made.
If I could just ask one quick follow-up question in that regard. There was some hope that maybe the governor would be mentioning something regarding funding for the Bills Stadium. I think, a week or a few weeks ago, there seemed to be some optimism regarding progress that was made. Have there been any setbacks or unexpected events occurring in negotiations that might be delaying this timeline, or are things progressing, normally?
This is a very complicated negotiation between three parties, and we will announce a deal when we have it. We're not going to announce bits and parts of what we agreed to or where we have disagreements. When we reach a final agreement, we'll announce it, and it's as simple as that. And I remind everybody, back in 2012, it was my goal as the county executive when we were negotiating the extension of the current lease that we have the announcement and everything completed by training camp. And we didn't announce the memorandum of agreement between the three parties until, I believe, December 27th, and then we didn't close on it until May of 2013. These are very complex transactions. They take time, and it's more important to get it right than to just do something quickly that's not in the best interest of all. Emily Gersh, Fox 29.
Hi, Mark. Can you hear me okay?
Yeah, talk a little louder, it'd be helpful.
So, following up on the bills negotiations question, are you confident that the Pegulas, the state, and the county will reach a deal in time for it to be included in the 2023 budget in April?
I'm confident the Bills will beat the Chiefs. That's about all I'm going to add with regards to the negotiations. As I said, it's a complicated transaction, and it's better to get it right than to just say we're going to get it done by an arbitrary timeline. Okay, Marley Tuskus, Channel 4.
Hi, Mark. So we heard that the county has filed a violation against the Village of Williamsville for their refusal to enforce the county's mask mandate. I'm wondering if you can comment on this and also provide any insight if this is the first instance of the county fining a municipality for not following orders.
This would be, to my knowledge, the first incident. We have multiple incidents that have occurred in the Village of Williamsville where not only the village mayor but others were not wearing a mask. We had sanitarians on site during the most recent meeting. They took notes, they took information, and the village was cited for violating the rules. And a fine, I believe, has been issued. I don't know the exact number. Actually, I think I know the number, but I'd rather you contact the Department of Health to confirm. But they were cited. They have violated through repeated violations. They've created an unsafe environment by having a public meeting where the public is invited and the village mayor is not wearing a mask as well as others. And we know that Omicron is can spread very, very quickly, and it is deadly. We did not have a death update today because we're still waiting for additional data from HealthyLink. We did announce 57 new deaths through, I believe, January 6th last week, including 4 individuals who were under the age of 50, one who was under the age of 30. So you can die from Omicron, and we want people to take this seriously. So, yes, the Village of Williamsville was cited. I believe they've been fined, though I would leave it up to the Department of Health to better answer the fine that has been issued. And if it is the first time that we fined a municipality, I hope it's the last. Let's put it at that. Breanne Rozier, Spectrum News.
Hey, good afternoon. I just kind of wanted to know how you're feeling overall with looking at the COVID data, seeing things kind of start to come down from this spike that we had.
Thank you. I'm very pleased to see the caseloads going down, the percentage positivity rate going down. As I noted, if you looked at the last 7 days, so this past Monday through the previous Tuesday, the positivity rate was 21%. The previous Monday to the prior Tuesday, it was 25.4%. But every day, if you do a day-to-day comparison, for example, Monday, this would have been yesterday, it was 20.4%. It was 27 the week before. Every day, it was 17%, 17.6 on Sunday. It was 27% the Sunday before. It was 19.7% on Saturday. It was 23.4%. And it goes like that with every day. So we're seeing reduced number of cases every day had a lower reduced number of cases in the past 7 days than the prior 7 days. When you do a day-by-day, Sunday to Sunday, Saturday to Saturday comparison, had a lower positivity rate. We've seen stabilization in regards to our hospitalizations. We're seeing more people actually going to the hospital that are COVID positive for other things than we did a few weeks ago. So I'm hopeful. I say we think we've peaked with regards to Omicron, and I'm hopeful that we've seen the worst of it. I don't know what the future is going to bring, if there's going to be another variant or not. I'm hopeful, like a lot of other people, that maybe because of Omicron and the way the variant is, it seems to protect against Delta. Maybe this will help protect many more of our people. I do expect people to still test positive for quite some time, and there are people who, because they haven't been vaccinated, are highly at risk for serious illness or death. And that's why we keep on telling folks, just because it's looking like better doesn't necessarily mean it's going to be better for you in the long run. Please get vaccinated. Brayton Wilson, WBEN.
Hi, Mark. Thank you. With the hope and the belief that numbers are starting to peak in terms of COVID numbers and hospitalization numbers, does that give you or the county any further enlightenment into lifting the mask mandate, or when phase one of the process here, we could see a potential end to that?
Well, we're not anywhere near that point. If you look back when we announced phase one in comparison today compared to where we were, our hospitalizations are higher, as well as, of course, our caseloads. So we do a review on a weekly basis, and we're not at that point where we would reduce that. I believe the governor has the face mask requirement for all indoor public locations, actually non-public locations too, except homes, through the end of this month, and that seems appropriate based on what we're seeing, but yeah, we're not there yet.
So your decision is going to be sort of tied in with the governor's decision statewide, at least?
Well, we're certainly, if this governor issues it, then that's the rule for New York State, but we're looking at it as it also pertains to our county, and we'll be continuing to look at it as it pertains to our county. As I say, I'm happy to say that our hospitalizations with regards to COVID patients seems to have plateaued. It's kind of hanging out at that same area. Goes up a couple cases, goes down, goes up a couple cases. And we're really pleased to see the caseloads go down, new cases, because we know that what often happens is it's a 7 to 10 day period after the person catches COVID when they end up in a hospital. So there's people who caught COVID in the last couple of days who may be not feeling so great, but they're okay at home, who could be in the hospital at this point next week. So we're not at a point yet where we would lift the mask mandate.
Thank you.
You're welcome. Is anybody on from Channel 7? Is there anybody on from Channel 2? WBFO Radio?
Yes, Mark, Mike Desmond.
Hi, Michael, go ahead.
The Seneca Nation is getting hammered by COVID right now, and in the past months, the areas right around where the nation is located, the border in Erie County, is this kind of feeding across the line, Collins to Gowanda, and are you still seeing terrible COVID problems down in those South towns?
Well, COVID does not respect the municipal lines or the lines between the Seneca Nation and other governments. So we look at it as a regional review, and I think it's important to note that a lot of people, especially in the southern part of our county, in Erie County, go to Cattaraugus County, go to Chautauqua County. Depending where they live, they may be in Chautauqua County, Cattaraugus County, and come to Erie County, like whether they're coming to Springville or Gowanda to do some shopping. And Gowanda is actually in both counties. It's in Cattaraugus and Erie County, one of the only villages in New York State to be like that. So we always are very concerned about what would be the transmission of COVID, regardless of who's catching it and where it is. So it is something we keep an eye on. We have in the past talked to the Seneca Nation with regards to COVID. I know that I spoke to a representative from the Seneca Nation last week, and they were in the process of distributing rapid at-home test kits to the members of their nation. I'm not certain where they got the kits from, if they came from the federal government or they purchased them themselves. But there is communication between Erie County and our friends with the Seneca Nation because we are all Western New York residents. We all are, and I'm pretty certain every member of the nation is a big fan of the Buffalo Bills. So while they may be part of the Seneca Nation, they are our family here in Western New York, and we do our best to ensure that all are protected. Erie County has worked with the Seneca Nation in the past, whether it's to address issues of healthcare, addiction. We've had plenty of conversations and work together. We continue to work on various issues, and we will in the future. And like we've seen, unfortunately, across the region, there was a very bad outbreak of Omicron for the last month and a half, pretty much. And we're doing our best to protect everyone, regardless of where they live. And we certainly wish everyone the best as they go forward. Is there any other media outlet I didn't call on? If not, thank you, everyone. It's a little shortened. We didn't have Dr. Burstein. I'm hoping to hear back from her later today as they get some new guidance from New York State on test to stay. It's always changing. It just seems to be what happens. But we've worked very hard these last few days. Once again, I want to thank our friends from Public Service and our Public Works departments across the region for their great response to the snow issue. It was not, and there never was in Erie County, my understanding, a state of emergency declared by any of the municipalities. Talked a lot with supervisors. Talked with Supervisor Eminger of Tonawanda, Culpa of Amherst, Benskowski of Cheektowaga, Dixon of West Seneca, Hoke of Hamburg, Mayor Iannello of Lackawanna, and of course Mayor Brown. And I want to thank all of them for their good work. And as we say, we're continuing to assist the city of Buffalo and the cleanup, as I know the city was having some issues. So with that, go Bills, beat the Chiefs, and see everyone next week.